So I think it's extremely important that, for one, we're clear when we're talking about these benefits to our members. And two, it's probably a good idea if you're not doing HRAs to start doing HRAs, because they're going to lose those benefits. And if somebody loses the benefits like utilities bills, payments, and other things, they're definitely going to be complaining about it. And we've already seen carriers out there that are terminating agents for elevated risk with higher CTMs than everybody else. Believe it or not, 1 or 2 complaints to Medicare could do that. I've seen agents, they've only enrolled 30 or 40 people in a plan, and they get 1 complaint, and bam, that is over the threshold for the carrier. They lose their ability to offer that plan this year and possibly into the future. Hey guys, Curt Graham here from Elite Insurance Partners. I'm the VP of Brokerage and wanted to give you a little industry update. AEP is here, and there's something that I don't think is getting enough coverage. You've started hearing about it in some of the first looks, maybe didn't realize what it means. I know I had to do some research on it, and I think it's pretty important. Before I get into the details of the new program, I want to talk about what it's replacing. And if you come over here, what we're looking at is the CMS Innovation Center. If you don't know what the CMS Innovation Center is, it's to develop and test healthcare and payment and system delivery models to improve patient care, lower costs, and align payment systems to promote patient-centered practices. Sounds all fancy. Ultimately, what they do is they come up with different ideas for Medicare. There's 96 different models that they've put out. If you watched my video about prior authorization and the Wiser model, that's where this came out of as well. Well, they came out with a model a few years back, and it's called the VBID model, or value-based insurance design model. And what it was is testing a broader way of MA health plan innovation aimed to enhance the quality of care for Medicare enrollees. Sounds wonderful. So everything's very flowery. Essentially what it did is it was allowing the Medicare Advantage plans to offer extra benefits that are not necessarily health related, like those food cards, like helping with utilities and pest control, air quality control in people's apartments, all sorts of different things, transportation to and from the doctor, and also non-medically necessary transportation were some of the things that could be included in Medicare Advantage plans. Unfortunately, this VBID model, it costs too much money, and CMS is ending it at the end of this year. They actually announced that they were ending this at the end of last year. And the reason that they are ending it is because of the $2.3 billion it cost in 2021 and $2.2 billion in 2022. I'm sure it cost a whole bunch of money this year. It was blowing out the budget. Those benefits were actually not necessarily improving people's health outcomes, and people were utilizing. They loved them. They loved the free health card, or the free card to go to the grocery store and buy different things. They loved utility payments. They were getting utilized. Plans were offering them, and it cost the government a heck of a lot of money. Well, it's now being replaced with a plan that's been around for a long time. In 2019, this was sent out to Medicare Advantage organizations, and they were implementing the supplemental benefits for chronically ill enrollees. Now, what's a little bit different about this is, in order for somebody to qualify for it, they have to meet a 3-part qualification. They've got to have one or more comorbidity, or have complex chronic conditions that's life-threatening or significantly limits the overall health function for the enrollee, be at high risk of hospitalization or other adverse health outcomes, and could require intensive care. It's actually not a 3-part. It's one of those 3. I misspoke there. So that is the SSBCI program. And they're making some updates to this program, and it's becoming more and more important because a lot of the benefits that are coming through SSBCI are similar to the VBID model. Well, here's from the Federal Register. They're clarifying the regulations around MA plans that it must follow a pre-written basis for objective criteria to determine if an enrollee is eligible for the SSBCI program. They have to demonstrate that there's a reasonable expectation for improving and maintaining overall health function for the chronically ill enrollee. In addition, they're finalizing some new policies for improved transparency, that basically not everybody's going to qualify for SSBCI. All that being said, what are those different health conditions? Here's a list of the different health conditions from cms.gov. And it's pretty far, it's wide. A lot of people are going to qualify for this. Chronic alcohol or drug dependence, autoimmune disorders, cancer, cardiovascular disease, chronic heart failure, dementia, diabetes, end-stage renal, a whole bunch of things, HIV, chronic lung disorders, bipolar disorders, depressive disorders, neurological disorders, all sorts of things. If somebody's had a stroke, as clients get older, most of them unfortunately have a lot of these conditions. So a lot of people are going to qualify for them, but the plans now have to demonstrate that the enrollee does qualify. How are they going to do that? Well, one of the things that we've been hearing from some of the carriers is it is important to do your HRAs this year, especially for those dual eligible enrollees, because a lot of benefits from the SSBCI program are targeted at the dual eligible enrollees. And if the carrier hasn't been able to verify that somebody qualifies at the beginning of the year, the member may lose those benefits later on in the year. A lot of the words and language has been not very clear on this when you're talking to the carriers. Ultimately, they're saying the HRA is going to help them identify people that would qualify for these benefits. A lot of carriers are going to be verifying through claims data and the doctor filling out the forms. But if somebody doesn't have claims data in the beginning of the year, doesn't end up going to the doctor in the first couple months of the year, then they may not have been able to verify those benefits. I don't know if the HRA is going to fully verify those benefits, or if it's going to, prompt the plan to reach out to the member and get them into the doctor, get some claims data behind it to verify that they do qualify for these benefits. The reason that this is important is at the beginning of the year, they're going to qualify for all of the SSBCI benefits. They're automatically going to get them. But if the plan can't verify that they should be getting them, then the plan is going to end up having to take those benefits away. And if a member is used to receiving utility bill services, we went down the list over here. There's a whole bunch of them. Meals beyond regular limits, food and produce, so that's going to the store, transportation for non-medically necessary needs, pest control, indoor air quality services, other special needs benefits, all of those different benefits. If they get used to using those and then they lose them 3-4 months into the year, they're going to make some complaints. And ultimately, those complaints are going to go to the carrier, they're going to go to Medicare, and that's going to probably end up falling on us, the agent, and the agency. And we've already seen carriers out there that are terminating agents for elevated risk with higher CTMs than everybody else. Believe it or not, 1 or 2 complaints to Medicare could do that for an agent. I've seen agents with 1 complaint that, is a newer agent. They've only enrolled 30 or 40 people in a plan, and they get 1 complaint, and bam, that is over the threshold for the carrier. They lose their ability to offer that plan this year and possibly into the future. So it's extremely important that we're doing this. Now, one of the things that they talked about is being clear that not everybody's going to qualify. And I came over here to Medicare.gov. Here's these special benefits: food and produce, meals, pest control, all the things that we just went over from that press release. And there is advanced plan approval required. So this is that little disclaimer that needs to be said. Basically, not everybody's going to qualify for it. So we can't just talk about that you're going to get these different benefits. Oh, yes, it's so great. Well, if you don't qualify for it, you're going to lose it. So I think it's extremely important that, for one, we're clear when we're talking about these benefits to our members. And 2, it's probably a good idea, if you're not doing HRAs, to start doing HRAs so that the plans have enough information to either justify that a member should have these benefits, or if they haven't, been able to reach out to the member hasn't been going to the doctor, hasn't had any claims for them to verify these benefits, at least they're highlighted and they can, get that person on the phone, try to, get those claims data in there to verify that they qualify for the SSBCI program, because they're going to lose those benefits. And if somebody loses the benefits like, utilities bills, payments, and other things, they're definitely going to be complaining about it. I think it's important. I don't think it's got enough coverage, this AEP. You're going to see it. It's a new disclaimer that wasn't really there in the past. Pay attention, be aware. HRAs are important this year. I hope everybody has a great AEP. If you want to reach out to us, a couple different ways you can do it. Go down in the description of this video. We've got links to our Facebook group. We've got links to my email and everything. Reach out to me. Would love to have a conversation if you need some more information. Would love to chat. All right. Have a great AEP, and let's crush it this year, guys.